The Flying Doctor service has been implemented by the government to provide priority population groups who have poor access to technology and services and less opportunity to utilise health resources with these necessary services through functioning in remote and rural areas. They are an aeromedical service that provide access to health services across Australia in order to decrease the gap between people living in rural locations and people living in urban areas. They're a responsive and unified service trying to overcome barriers to healthcare. The federal government has also introduced the Closing the Gap campaign, utilising the action area strengthening community action by allowing Aboriginal and Torres Strait Islander people to work with governments in order to reduce the gap between their health and other Australians. Some factors that have significantly widened and initially created the gap between Aboriginal and Torres Strait Islander health and other Australians are their history of social oppression, being victims of racial discrimination, large populations living in rural and remote areas, their language barriers, and the misunderstanding of cultural systems and connections. 1/3 of Australia's Aboriginal population lives in New South Wales. 8.5 to 9.3 years of life expectancy gap between Aboriginal and non-Aboriginal people in New South Wales. Mental illness problems account for 10% of the gap. In 2013, Aboriginal and Torres Strait Islander prisoners made up 23% of New South Wales prison population. Aboriginal people are 3 times as likely as non-Indigenous people to be hospitalised for intentional self-harm, and the suicide rate of Aboriginal people is 1.4 times that of a non-Indigenous person in New South Wales. And this is a graph to show the infant mortality rate per 100,000 people. This red one is the Indigenous rate and this is the non-Indigenous rate, and you can see it's a lot higher. The provision of translators and multi-language resources has also helped migrants and Aboriginal people access and navigate the Australian health system. The health system tries to ensure that there are translators in hospitals and community health centres in culturally diverse areas or areas with a majority of one culture, for example, Bankstown. Over 65% of respondents say that the Australian healthcare system is difficult to navigate. People want to know the cost, quality, and availability of services. 10% of people currently access personal health information on their smartphone, but 50% want to. Over 45% of respondents had difficulty accessing healthcare when they needed it. Top reasons given: cost, location, or they couldn't get an appointment. The top 3 activities people want to be able to do on their mobile device are 1. Manage their medication, 2. Track their health, and 3. Request refill prescriptions. And this is Australians that want digital access to health, so that's what that's about. So as you can see, even though there's all these resources, there's all these plans taken action so that they can increase health and decrease the gap between these disadvantaged groups, there's still lots of inequities. These services, campaigns, and resources all allow for equitable access and support for all sections of the community by covering the social justice principles, diversity, equity, and supportive environments. The government action and community support has allowed the Australian healthcare system to achieve justice for disadvantaged groups and improve the gap between these groups and privileged Australians. However, with these services in place, the results continue to prove a significant gap, and the objectives for many campaigns have not achieved their goals successfully.